Lately, YouTube is constantly showing me a commercial with an alleged NHS doctor who has found a remedy to shrink a swollen prostate. I find this commercial really annoying because of the misinformation it contains. Benign prostatic enlargement, sometimes also referred to as benign prostatic hyperplasia, is not a swelling. It is real cell growth. Now I said it. Therefore, it is impossible to reduce its size like you would reduce any swelling. You can't press on it to make it smaller, and you can't eat vitamins to make it smaller either. It's like with your nose and ears. As you age, cartilage continues to grow, which over the years enlarges your nose and ears. You can't make that go away by pressing on it or eating vitamins. So why exactly the prostate grows and why some men are spared is not precisely known. But with age, there are a number of changes occurring in the prostate, including inflammation. I recently uploaded some videos about inflammation of the prostate. I will link the playlist at the end of this video. Swelling of the prostate only occurs in acute bacterial prostatitis and after certain medical procedures like high-intensity focused ultrasound for prostate cancer treatment. But this has nothing to do with benign prostatic enlargement. So don't be fooled by any of these videos and ads offering you easy, homemade solutions regarding an enlarged prostate. Some of you asked about prostate congestion in the comment sections of previous videos. Prostate congestion is no longer used as a term in modern urology. The concept of a congested prostate has to be regarded as outdated. If you have any symptoms regarding the lower urinary tract, you will have to consult a urologist. There is no other way, because very different conditions may cause very similar symptoms. So don't assume you have a problem with an enlarged prostate just because you recognize some of the symptoms Dr. Google is giving you. There is also urinary tract infection, prostate cancer, pelvic floor overactivity, diabetes, and many more, which may be responsible for your problem. That has to be sorted out first before you start any treatment. You can't do that on your own. You need an expert. Together, you can then figure out what to do in your individual case. And yes, in light cases, it may come down to pumpkin seed oil or saw palmetto or both. It may include a change in lifestyle as well. However, a reduction of symptoms does not necessarily equal a reduction in prostate size. The symptoms may disappear, but prostate size may remain unchanged. You wouldn't be able to feel that. It is not quite clear how pumpkin seed oil, and saw palmetto work. Obviously, there is some alpha reductase inhibitory action, meaning that the conversion of testosterone to dihydrotestosterone is blocked within the prostate, leading to a lower prostate volume. But this effect is not very pronounced, not like in real 5-alpha reductase inhibitors. In pumpkin seed oil, there is a high amount of phytosterols. Phytosterols occur naturally in plants, and chemically, their structure resembles that of cholesterol. But they lower low-density cholesterol levels in the bloodstream, which is why they are added to certain foods, and they have anti-inflammatory properties. If you have watched my video on type 4 prostatitis, you know that inflammation seems to be a promoter of prostate growth and symptomatic BPE. So the effectiveness of pumpkin seeds may be based on these properties. However, phytosterol is not all good. You should limit your daily intake because it may have some side effects. A recent study from the University of Leipzig found a possible increased risk for coronary artery disease with high intakes. There is also concern that phytosterols may accumulate on the heart valves, and they may cause problems with microcirculation in your retina. Many products have phytosterols added to them, so it's easy to ingest a high dose. They used to sell and promote a margarine high in phytosterol here in Europe, which was removed from the market. So be careful with phytosterol. If you find the information of this video useful, please give it a thumbs up and subscribe. Here's the playlist about prostatic inflammation. Thanks for watching. Bye bye.